I also spoke with Senator Debbie Stabenow from Michigan, who serves as chair of the Finance Subcommittee on Healthcare. We've got all the important folks in healthcare in Congress with us. Take a listen to my conversation with Senator Stabenow.
Senator, it's so great to see you again. Thanks for joining us to talk about, really, really important issues, which you've been working on for a long time. And I would be remiss if I didn't say right on the front end of this, condolences to you and your constituents and people around the country for what just unfolded in yet again, another gun violence incident in schools. And this just raises an issue I have talked about so much, is how do we improve and up our situation when it comes to alertness and understanding where people are and mental health? What is missing? I don't know if you see a connection between that work and what unfolded, but certainly the stress of what just unfolded is hitting a lot of folks.
Well, see, first of all, it's wonderful to be with you as always. And while we don't know all of the specifics on this particular situation with the 15-year-old and so on, there is no question that we have got to strengthen what we're doing around mental health services in schools. We have school-based health clinics right now, but they are not funded as they should be. I have a bipartisan effort that we've been pushing to get increased resources into schools now because of COVID. When I talk to school superintendents and say to them, what's your number one challenge? They say mental health. And so because of all the challenges of children in so many ways around, not being in school and being on Zoom and coming back to school and just a lot of normal pressures in addition to everything else going on. And then you add to that the stress. In talking to teachers at Oxford, it breaks my heart. I mean, the immediate situation here, as well as parents and so on. So the community behavioral health clinic framework that you and I have talked about so much, that Roy Blunt and I have championed, is part of the solution, making sure that we have the community-based resources fully funded, like we fund healthcare below the neck. It needs to be comprehensive healthcare. And I will say that the Build Back Better effort that we're working on to get done by the end of the year takes a huge step because it opens up full funding for our community behavioral health clinics to states across the country for the first time. So it's very important.
Well, thank you for that. And I wanted to ask you about Build Back Better, because Build Back Better is basically, in my view, a real conglomerate of stuff now. There's so many elements to it. And frankly, it's hard to keep track of what's in, what's out, what it will do. And I guess as we sit here today and talk about what's strong in our healthcare system, what's not strong, what are the planks that are missing, I'm interested in what you see that Build Back Better specifically brings to America's healthcare picture that are big jumps forward.
Absolutely. This is really important. And when you look at all of what we're talking about, bottom line, first of all, it's about lowering costs for people, the kinds of things that keep you up at night, like the cost of prescription drugs. So it's lowering costs for people and costs that have been around a long time. And then secondly, investing in the future for our kids and for our economy. That's what we are doing in this package. And so on the healthcare front, highest costs that we have as taxpayers and as individuals in the healthcare system, prescription drugs. And so we are taking major steps to begin to negotiate lower prices, to put a $2,000 cap for seniors on how much they have to pay out of pocket per year under Medicare, to stop price gouging. Right now, prices are going up 3 times faster than inflation every year. We're going to cap that at inflation. And really, and importantly, we are putting a cap on the cost of insulin to $35 a month for your child who's a diabetic or yourself. Right now, average costs are something like $600 a month. And so we're lowering costs. We're going to lower costs on the Affordable Care Act, healthcare provisions. We started that in the American Rescue Plan. We want to keep those costs low. And we're going to tackle a number of things like home care, community-based care. We see families caught on both ends, that they're juggling children and the cost of childcare on one end, costs of taking care of mom or dad or grandma or grandpa on the other end. And so lowering those costs for folks is going to make a tremendous difference.
Do you sense that there is a tension, as we hear from some people in industry and in the healthcare ecosystem, that there's a tension on cost capping, some parts of that world versus innovation and continuing to get the big strategic leaps we've seen in innovation and drugs and whatnot? What are the trade-offs you feel, and how do you keep both sides of the equation robust and working right?
Sure. Well, I've worked in this area, particularly around prescription drugs, for a lot of years. And there's no question we have amazing innovation. And what we've seen with the vaccines is just one example. But I have to say that we as taxpayers help pay for that. The basic research that allowed this to move forward as quickly as it did came from the National Institute of Health. It came from, we've had in the last some 10 years, 200 billion or 300 billion plus dollars being given to drug companies and others to help, to pay for the research. So we're doing that as taxpayers. We're paying for the research. We allow the companies to deduct the cost of research as a business expense from their taxes. So we contribute again to support them. And then all that I ask is that we can afford the medicine at the end of it. And I think that's a reasonable thing when we see that American taxpayers, American consumers pay more than anybody else in the industrialized world for our medicine. And it's not necessary. The companies make a profit in every other country. They can just do more in our country. So I support innovation. I'm a huge a proponent of that piece of it. But I think it's disingenuous when they are saying they're going to have to cut research if we want reasonable prices and can afford the medicine. Because the truth is, taxpayers are playing a major role in funding that.
Let me ask you another question. We've been talking about the mental health side of this, you, Senator Blunt, myself, for years. And one of the things, and this is my editorial view and editorial opinion, is that there was a time in America's healthcare system where the economics of healthcare didn't leave much space in private healthcare or anywhere else for mental health and behavioral health support, work, attention, resources. And one of the goals of Affordable Care Act was to begin focusing on wellness, whole health, as opposed to fee for service. I kind of lost track, to be honest. This is an unfair question for a U.S. Senator. I should be asking a CEO of a major healthcare system. What do the economics now look like? Is whole health getting the economic platform it needs that includes health above the neck?
Well, it's moving in the right direction. And there's a number of things. Focusing on wellness. We now pay for a once a year wellness checkup for everyone under Medicare that wasn't paid for before. So you get that prevention, the checkup, comprehensive checkup. We certainly need to be doing more of that. I authored the provisions in the Affordable Care Act to require that insurance companies are funding mental health and addiction services the same as physical health. But frankly, it's a hodgepodge as to whether or not that's really happening as it should right now. But when we look at the economics, the interesting thing about healthcare is you don't save money when we cut services to people. We actually save money when people can get the healthcare they need, particularly comprehensive healthcare. For instance, expanding Medicaid. In Michigan, we were part of the Medicaid expansion effort that got folks out of the emergency rooms and into the doctor's office. And the state of Michigan, in the first year, I think, saved some $400 million on paying, less than they were paying for folks that were really sick sitting in the emergency room. And so health systems benefit when people can get to a doctor, or whether it's a physical doctor, whether it's a psychiatrist. If you can get help on the front end, you are saving money for the healthcare system rather than picking up the pieces. And on behavioral health, we now have very specific numbers showing that we're keeping people out of jails because they can get help. The 24-hour psychiatric crisis center, we don't leave law enforcement in a position where they don't know what to do with someone who's got a problem, so they go sit in jail. And so there's a whole range of ways in which we save money for all of us by helping people get the services they need when they need it.
Senator, I'm one of these people that looks at our experience during the pandemic and seeing the heroes on the front line, the healthcare workers, the hospitals, the innovation in the pharmaceutical industry to get vaccines at a miraculous rate, et cetera. All of that dimension is something I feel we should be proud of. Now, I know that that's a controversial statement in some parts of the country and some parts of Michigan, but that's just the way I see it. But I'd be interested in your insights into, a pandemic doesn't come along every day, but we're in the middle of it. We're still in the middle of it. What lessons should we be drawing regarding public health and our health infrastructure that we ought to be learning from now and not forgetting when we get to the other side of this?
See, this is really important. And first and foremost, that we need to be prepared. We didn't have the stockpile for medical equipment, the basic masks and gloves and gowns. And recently, I organized a meeting for Senate colleagues to meet with the folks that do preparedness in Health and Human Services. And they are dramatically ramping up what we have just in terms of medical supplies and so on, because we saw what happened when we're trying to get medical supplies from around the world. And I spent a lot of time trying to find a guy who knew a guy who knew a guy in China, Michigan. I mean, literally. And so we're in a situation where we have to be prepared, and you can't skimp on those resources. We also have to make sure we are making that in America. And so we're now making the gloves in America. We're now making masks in America. We're now not dependent on international supply chains. We also need to focus more on prevention. I've been in county government overseeing the public health department. I've been in state government, now federally. It's so easy to cut prevention because you don't see it. It's not the crisis right in front of your face. And yet we know that public health infrastructure, the capacity to move quickly in a crisis, is very, very important. So there's a lot of lessons, and I give great kudos to everyone involved in the vaccines developments. And we certainly need to continue to be investing in the new innovation, but we've got to have those systems in place.
Well, we'll have to leave it there. Senator Debbie Stabenow, I want to remind our audience, is chair of the Health Subcommittee of the powerful Senate Finance Committee, and she's on these health policy issues all of the time and never says no to the Hill when we call. So Senator Stabenow, thank you so much for joining us today.
My great pleasure. Take care.
Thanks again to Senator Debbie Stabenow. That brings us to the end of our program today. A really big thank you to the Partnership for America's Healthcare Future for its support, and to all of you attendees for joining us for these discussions. For anybody who missed this today, we're going to have the video up from the event on our website shortly. I'm Steve Clemons. Be well.